Welcome back. I'm your healthcare advocate, Cary Hall. You're listening to America's Healthcare Advocate Show, broadcasting here on the HIA Radio Network, coast to coast across the USA. My producer, Mr. Rod Babcock, my special guest in studio, Ron Rowe, Senior Director, Consumer and Small Group Markets, Blue Cross and Blue Shield of Kansas City. If you want information, contact your local broker or 816-395-2939. That's 816-395-2939 or online. You just want to go look. Maybe you're curious. You don't want to talk to a broker or a salesperson. Go look. Go online. BlueKCExchange.com. It's up there. You can go see the whole thing. BlueKCExchange.com. That is the website. Ron, let's talk about the mechanics of this. And I can just hear the brokers out there. Oh God, they're going to go to the exchange. They won't be working through the broker anymore. Blue Cross of Kansas City, you guys, this has been broker-centric since I started doing this 15 years ago. You use broker distribution as your network. You're not selling direct. It's very important for the broker community to understand. And it's important for employers to understand why the broker. So why don't you get into that?
Brokers traditionally have played a vital role in helping employers select their health insurance. And this exchange does not change that at all. The broker still plays a very vital role in the Blue KC exchange. As a matter of fact, their role is even gotten a little bit bigger, if you will. An independent broker can help an employer determine, they can tell them a lot of things about a health insurance company that a health insurance company might not necessarily tell them, that employer. And you just think about it, just at the very basic level.
I could name a few, but I won't.
At the very basic, stability. Stability.
I know.
Is this a type of company that's going to give you a low rate today and then give you a big rate increase next year down the road?
Or how much of the market do they control in this? In
market share, service level. Are they going to pay the claims on time? So brokers have experience with all the carriers, so they've played a vital role. They can give that employer an independent assessment. Okay, the Blue KC exchange does not change that. You cannot purchase this product for your employees without going through a broker. Okay. Let's make that clear, first of all. And what you're alluding to, I think, Cary, is there's a lot of brokers that think with the healthcare reform bill that's coming out in 2014 that the federal government wanted to cut out the role of the broker. Well,
that's true.
In the Blue KC exchange, that is not the case. Okay, so this is the way it starts. The broker comes out and meets with the employer and explains to the employer defined contribution, the things that we just talked about, and helps them determine, how much are you actually contributing today per employee. If they don't know, the company may or may not know what it is per employee because the way rating is done. They might not know that. So they'll help them determine what it is they're paying today and how much is it that they can afford to pay going forward to help them determine or set that defined contribution amount, if you will. And go through the underwriting process, because all these plans are still underwritten the way they're underwritten today. But once the employer says, yeah, I like this idea, I like the concept of controlling my cost, of giving all my employees a certain amount, letting them choose and passing the choice on to them. Now, if I'm an employer and I've got 50 employees, that broker's got to help my 50 employees.
That's it right there.
Yeah, as an employer, I'm not going to turn them loose. These folks have never been involved in this before. As an employer, I've narrowed it down from 10 different carriers to 3 different plans, and I've taken a lot of the shopping out of the equation for the employees, if you will. And now I'm going to say, here's $300. You're on your own. Well, no, you're not on your own. That's where the broker comes in to help those 50 employees look at the 10 different plans. Okay, we talked about there's 10 different plans. So the broker will help the employer go through how much it is that they can afford to contribute and want to contribute, and what will the employees get for that, and walk through that scenario and compare that with their current plan, or if they don't have coverage, what that would be. But now they're going to help the employees go through the selection process of which one of the 10 plans is best for their individual situation. We talked about some obvious things, that if you're young and healthy, you probably want a higher deductible, and if you've got sick kids, then you're probably going to want a lower deductible, more first dollar coverage. But that's the role of the broker and the exchange. And the exchange also has, what we've built into it is some features that help the employees through that process online. So they can go online and they can take the plans and put them side by side and compare the plans and then make their selections and do the enrollment.
So they can go onto the website and they can see all of this stuff on the website if they want to do that.
Sure. Anyone can go onto the website today and see the 10 different plans. You won't know what your particular situation is in terms of how much your employer is going to contribute and how much would be coming out of your own check as an employee until you go through the underwriting process and the rates have been determined for that group. Because like I said, these still get underwritten and each group will have their own rates. But they can see the 10 different plans that are available. An employer can see those 10 different plans. But once the employer says, this is what we're going to go with. We're going to offer the Blue KC Exchange to our employees. Then the broker at that point controls the enrollment process with the employer to the employee. So if the employer doesn't want to actually let all of those employees go out and do this on their own, the employer can control that. There's a way for the employer to go on and log in and do the enrollment for their employees, or they can actually let the employees go on and do it themselves. So there's a role for the broker online, there's a role for the employer online, there's a role for the employee. The broker and the employer are in total control of this process, even though they're letting the employees have the say in what type of plan they want to buy.
And here's where the role of the broker becomes, as you said earlier, probably going to be more for the broker to do, Ron, because the broker is going to sit down with a group of employees and say, okay, you're 35, you've got 3 children. We need to look at a Blue Premium plan for you. You're going to need urgent care. You're going to need unlimited doctor visits. You're going to need these things that are available, 3 tiers of prescription drug coverage, et cetera. Oh, here's the 21-year-old. We all know you're not going to the doctor if you don't have to, unless you slide into third base and sprain your ankle or break your ankle. So we're going to talk about affordably for you. Here's 5 doctor visits. Ask the guy, when was the last time you went to the doctor 5 times? He hadn't been to the doctor 5 times in his life.
Sure.
So for him, but the broker has to explain that, Ron. They have to understand what it is they're getting. And then you get to the HSA, which we talked about before. What's the mechanics of the HSA? How does it work? Do I get to keep the money? Does the employer get the money? This is all part of what a broker does.
And there are HSA plans available. Of the 10 plans, there's HSA. Yes. What you're describing, Cary, you alluded to it earlier. You said, you go out and do these open enrollment meetings and all the employees are sitting there with bated breath waiting to hear the bad news you're getting ready to tell them as a broker. Well, the dynamics of those meetings are going to change dramatically under the exchange. Because if you're a broker coming out now to explain what your health benefits are going to be next year, and you're offering, and the employer's offering the exchange, it's exactly what you're going to do as a broker. You're going to talk a high level of the different plans and the types of things that high level scenarios, if you will, that maybe you want to go this way or go that way. But then I would assume most brokers are going to be available, and if not, Blue Cross has staff. We've reorganized to make this available so that.
But that's a broker's job, Ron.
It is a broker's job. It is a broker's job.
I'm a broker. That's our job.
And most brokers will want to do that.
Yeah.
But again, though, it's going to be a little bit more work for the brokers. But,
yeah, it is. Well,
but at the end of the day, I think everybody wins. The brokers are still involved in the process. The exchange hasn't cut the broker out of the process. They've got, like I said, they've got a bigger role now. You've got the employer who's winning in terms of controlling their cost. And then you got employees who have many more options and can decide what they best need and want.
We're coming up on the break here in a minute, but I want you to touch on one other thing. There's money left over. I've got money left over. I got $300. I only need $200. What's going to be available for ancillary products? Can you touch on that just a little bit, that they can use those other dollars for?
Right now, we don't have ancillary products out on our exchange yet. They're coming. Hopefully, by the summer, we'll actually have products right out there so they can go on. But the employees can still use those dollars for ancillary benefits that the employer might offer off of our exchange. If they've got a life insurance policy, or they've got Aflac plans, or they've got U.S. Able products in place.
U.S. Able is a Blue Cross product.
The U.S. Able products we're going to actually put out on our exchange. But the point is, if the employer's got something else that they're offering, the employees can still use that money towards other benefits. They just can't take it in the form of cash.
See, that's really important because when you talk about flexibility, especially to the people at each end of the spectrum, not so much for folks that are going to buy that premium plan, but that 50-year-old that's going to buy the HSA and put that money in his HSA account, or maybe they want to add a little more life insurance, a USAble life plan, or for that 29-year-old.
Critical illness plans, those are. So again, we're going to have those available out on the exchange so that when the employee's going through the shopping experience of selecting their health care and they've got $50 left over, they've got an easy way to decide what they might want to do with it right there online. But you have some employers then that if those ancillary products aren't offered, then the employer gets to keep that extra $50 then.
Yeah, well, we'll see how that works out. We're going to come back after the break. We saved the best for last. You don't want to miss this last segment because we're going to surprise you. This sounds really good. It's going to get a lot better in the last segment. There's something coming up here. It's going to make a huge difference to employers. We'll be back after the break. You're listening to America's Healthcare Advocate, broadcasting on the HIA Radio Network, coast to coast across the USA.